Losartan potassium can be given to you to treat a few of the conditions like elevated blood pressure. This drug is well popular under the brand name Cozaar. Elevation in the blood pressure may cause a few of the cardiovascular complications like an increased risk of stroke. In addition to lowering blood pressure, Losartan has other effects. It can reduce the fibrosis that damages cardiac muscle. Therefore, Losartan is useful in many conditions that are associated with elevated blood pressure. However, when this Losartan is used, you should know a few important facts, like what is its impact on electrolytes? What is the effect of other medications? Whether it is useful in the pregnancy or not. All such facts are important to know before using Losartan potassium. So in this video, we will cover all such key facts about this medication. Clinical uses. Losartan can be used for the management of hypertension. It is classified as angiotensin II receptor blocker. This medication inhibits the renin-angiotensin system by blocking the actions of angiotensin II. It is a potent vasoconstrictor. When it occupies the angiotensin II receptors, it can produce contractions of blood vessels. This increases the blood pressure. Losartan can be given to treat this hypertension in people. Second, clinical use of this medication is in the left ventricular hypertrophy associated with hypertension. In people with hypertension for several years, they may have increased risk of left ventricular hypertrophy. It is a condition of increased thickness of left ventricles. When you have hypertension for several years, your blood vessels become hard, and they offer high resistance to blood flow. This prompts the heart to pump in a harder way to override this resistance. For this purpose, heart muscles become thickened, and particularly at the left ventricles, the thickness of heart muscle increases. Initially, this may increase the pumping force. However, the increased thickness may reduce the volume of the blood to be filled into the ventricles. It may also result in the hardness of the muscle. Slowly, ventricles lose their elastic property and become hard. They are unable to pump blood in a proper way. This eventually results in reduced pumping capabilities of the heart. Therefore, people with left ventricular hypertrophy may have a few symptoms like shortness of breath, and they can have difficulty breathing when they're lying down. They can also have swelling in their legs because of poor circulation. Chest pain can be observed, particularly during exercise. They may have palpitations leading to rapid and pounding heartbeats. People may have weakness, dizziness, and fainting. All these symptoms of left ventricular hypertrophy are associated with hypertension. However, many other risk factors are also responsible for left ventricular hypertrophy. People with diabetes, obesity, or excessive alcohol intake may also have an increased risk of left ventricular hypertrophy. But for most people, elevated blood pressure is the main reason for left ventricular hypertrophy. If it is untreated, this hypertrophy may result in a stroke and death in the people. Therefore, Losartan can be given to reduce the blood pressure and reduce the risk of stroke in people with left ventricular hypertrophy. The third clinical use of this medication is in the treatment of diabetic nephropathy. Losartan can also be given to a condition called diabetic kidney disease. It is also known as diabetic nephropathy. It is a chronic condition that was observed in people with elevated levels of glucose for the past several years. When you have high glucose levels, they can impact many of the organs in your body. Particularly, the filtering system in the body may be affected because of the high load of glucose in your blood. The blood levels in your kidneys are damaged, which actually filter waste from the blood. This leads to improper working of the filtering mechanism, and a kidney dysfunction appears. This brings a few physical changes in the urine. You may have foamy urine. Due to poor excretion of fluids, you may have swelling in your hands, feet, and face. You may feel tired and experience a loss of appetite. Nausea, vomiting, and shortness of breath can also be observed. In diabetic nephropathy, because of poor filtration of body fluids, serum creatinine levels are increased, and proteinuria can be observed. In this condition, urinary albumin to the creatine ratio is elevated to greater than 300 milligrams per gram. Even though elevated glucose is the main reason for diabetic nephropathy, another main risk factor in such people is hypertension. Losartan can be given in diabetic nephropathy to reduce the blood pressure. It can prevent further damage to such people. How long does it take to work? When you take Losartan, it starts working in 1 hour. The peak levels of this medication in your body can be observed within 1 to 1.5 hours. You may notice a reduction in your blood pressure after 1 to 6 hours. However, it may take a few days to show its full effects on reducing blood pressure. This medication has a duration of action of 24 hours, and it works throughout the day. Therefore, it is to be taken only once daily. How to take? Losartan is available as tablets, and you can get them in 3 strengths such as 25 milligrams, 50 milligrams, and 100 milligrams. The dose of losartan depends on your age, purpose of use, liver function, and other medications co-administered. You may be given losartan either alone or with other blood pressure-lowering medications. Therefore, the dose of losartan may be low when it is combined with other medications. If it is given to you as monotherapy, the typical dose may start at 50 milligrams, given once a day. However, based on the clinical response, the dose may be increased to 100 milligrams per day. In a few people, losartan may produce significant hypotension at higher doses. Therefore, it shouldn't be used at higher doses initially. The hypotensive effect may even be observed at normal doses if you have low body volume or if you're using diuretics. For example, if you're using diuretics like thiazides, they can increase urinary excretion and produce loss of body volume. This may help in reducing your blood pressure. That's why they may be combined with losartan for producing better control on blood pressure. However, if you're using strong diuretics like loop diuretics, you should be very cautious while using losartan because loop diuretics produce a high loss of body volume. When they are given along with losartan, they produce very significant hypotension. Normally, loop diuretics can be given to you to treat edema. Suppose if you're already taking loop diuretics, never start losartan at normal doses. This may produce significant hypotension. Therefore, before using losartan, check whether you are using any diuretics. In the presence of strong diuretics, the initial dose of losartan should be reduced to 25 milligrams per day. In cases of hypertension associated with left ventricular hypertrophy, losartan alone may not be sufficient even at higher doses of 100 milligrams per day. Therefore, another medication like diuretics can be added along with losartan. Hydrochlorothiazide is one of the commonly used thiazide diuretics that may be combined with losartan. It can be started at a dose of 12.5 milligrams per day. Based on the response, the hydrochlorothiazide can also be increased up to 25 milligrams per day. Therefore, you may be given losartan 100 milligrams plus hydrochlorothiazide 25 milligrams at the maximum level. Use in children. Losartan can also be used in children with an age above 6 years. However, in children, losartan is given based on their body weight. Generally, it can be given at a dose of 0.7 milligrams per kg of their body weight. The dose calculated based on the body weight is typically within 50 milligrams. How it works? Losartan is classified as an angiotensin II receptor blocker. It acts on the renin-angiotensin system and inhibits the actions of angiotensin II. Normally, angiotensin II is one of the important mediators within this renin-angiotensin system. This mediator has several roles in your body. One of the main roles is to act on the blood vessels, where it produces contractions of the arteries. This increases the blood pressure. However, this mediator can also have other physiological actions that add to the raise in the blood pressure. It can also increase the aldosterone secretion. Aldosterone is a hormone that increases the absorption of sodium into the blood from the filtrate in the kidney. This again increases the blood pressure. Another action of angiotensin II is on the hypertrophy. It can increase the thickness of muscles like renal arteries, as well as cardiac muscle. All these actions of angiotensin II are mediated by its action on its receptors. Angiotensin II can act on its receptor, called angiotensin II receptor type 1. Now, losartan blocks these receptors. Thereby, it reduces the blood pressure as well as the secretion of aldosterone. Is it causing a cough? Even though losartan is less likely to produce the cough than ACE inhibitors, a few people may experience a dry cough with the use of losartan. Normally, ACE inhibitors like enalapril and ramipril are associated with dry cough in people. These drugs are going to inhibit one of the enzymes, ACE angiotensin converting enzyme, which is responsible for the conversion of angiotensin I to angiotensin II. In addition, this enzyme is also responsible for the breakdown of bradykinin. But when this enzyme is blocked by ACE inhibitors, bradykinin breakdown is inhibited, resulting in the accumulation of bradykinin. This results in dry coughs in the people. However, losartan is an angiotensin II receptor blocker. It is not inhibiting the ACE enzyme. It is not directly producing any accumulation of bradykinin levels. However, it may also produce coughs in a few people. Effect on fibrosis. Fibrosis is a condition of thickening of the tissue. A normal functioning tissue is replaced by a fibrous connective tissue that results in loss of function. It occurs due to either injury or inflammation. Fibrosis may lead to reduced functioning of the affected organ. It may also lead to organ failure. Losartan can prevent fibrosis by its unique mechanism. It reduces the levels of one mediator called transforming growth factor beta-1 that is actually responsible for fibrosis. It also reduces the expression of collagen 1 alpha, which normally increases cell proliferation. By blocking these mediators, losartan can reduce fibrosis. Therefore, it can prevent heart fibrosis and reduce its damage. Apart from these clinical indications, losartan can also be given to a few people with specific genetic disorders. One such clinical indication is the Marfan syndrome. It is a genetic disorder that affects connective tissues and even affects the heart. The walls of the aorta may be weakened and bulge. People with this genetic disorder may have enlarged heart valves and abnormal heart rhythm. Losartan is given to manage this condition due to its two effects. First, it can reduce blood pressure and control a few symptoms. Second, it can reduce a condition called fibrosis. Losartan is also used in the epidermolysis bullosa. It is again a genetic skin disorder that is associated with inflammation leading to blistering and fibrosis of the skin. Losartan can be given to reduce inflammation because this drug may have an effect on reducing fibrosis. It can also improve skin healing and prevent the narrowing of blood vessels. Serum potassium levels. Losartan can increase your potassium levels. This is because of its action on the renal system. Normally, angiotensin II is responsible for the secretion of a hormone called aldosterone. This hormone can increase the absorption of sodium into the body from the renal tubules. But when the angiotensin II actions are blocked, aldosterone is not secreted, which results in the increased excretion of sodium. When sodium is excreted, potassium is more retained in the body, leading to higher levels of serum potassium. So while you are taking losartan, monitor the potassium levels regularly. A high potassium level may be fatal, and it can produce few symptoms that resemble a problem in your heart. You may have chest pain, difficulty breathing, nausea, vomiting, irregular and pounding heartbeats. It can also produce muscle weakness, loss of sensation, and tingling sensation in the arms and legs. Abdominal pain, diarrhea, and even sudden collapse may be observed with high levels of potassium. Therefore, while taking losartan, carefully monitor for the symptoms of hyperkalemia. If you observe any hyperkalemia, discontinue the treatment or reduce the dose. The potassium levels can also be elevated by many of the other factors, particularly when you're taking over-the-counter medicines, vitamins or minerals, or even herbal products. They may increase the potassium levels in your body. Therefore, while taking losartan, carefully monitor these medications. If you are taking potassium supplements, they can increase the risk of hyperkalemia. Combinations. Losartan can be combined with other drugs for significant lowering of blood pressure. One of the most widely used combinations is the use of diuretics along with losartan. Diuretics increase the excretion of body fluids, which reduces the body volume. There may be a reduction in cardiac work and a reduction in blood pressure. Losartan inhibits the angiotensin system, thereby directly inhibiting the contraction of blood vessels by angiotensin II. When these two are combined, a significant reduction in blood pressure can be produced. So losartan can be combined with thiazide diuretics like hydrochlorothiazide. Particularly, this combination is suggested whenever you have a high risk of stroke, heart attacks, and excessive body fluids. Losartan can also be combined with calcium channel blockers. For example, amlodipine is one of the calcium channel blockers that can be combined with losartan. Amlodipine directly relaxes the blood vessels, thereby producing a significant reduction in blood pressure. There is a fixed combination of losartan and amlodipine, where losartan is given at a dose of 50 milligrams and amlodipine at 5 milligrams. However, this combination may produce significant hypotension and dizziness in the people. Therefore, you should be cautious while taking this combination, especially during the early days of treatment. Acute renal failure. Losartan acts on your renal system to reduce the nephropathy. However, in a few people, it may produce acute renal failure. Since Losartan is going to inhibit the renin-angiotensin system, this medication should be carefully given in people where the functioning of this system is highly essential. For example, in people with a condition called renal artery stenosis, they may have contractions of the arteries supplying the kidneys. This contraction may be due to the formation of plaques within the blood vessels. Otherwise, it may be due to increased thickness of the artery walls. Such people may experience high blood pressure, reduced renal function, and even it may lead to acute renal failure. Losartan can reduce the blood pressure, but when it is given to people with bilateral artery stenosis, it can further reduce the renal functionality, leading to acute renal failure. Similarly, in people with severe congestive heart failure, this medication may develop renal failure. Lithium levels. Lithium is used to treat bipolar disorder. It can control mania and hyperactivity. However, this mineral is somewhat similar to sodium ions. Therefore, excretion of lithium is affected by losartan. Losartan reduces the secretion of aldosterone and increases excretion of sodium. To counteract this effect, your body tries to retain more lithium, as it is similar to sodium. This results in an elevation of lithium levels in your body, leading to its toxicity. Therefore, when you take losartan, the lithium dose may be adjusted. Use in pregnancy. This medication can produce damage to the fetus. Therefore, it is not recommended in pregnancy, particularly in the second and third trimesters of pregnancy. It can reduce the fetal renal function and increase the risk of fatal damage. It also causes a condition called oligohydramnios, where amniotic fluid is reduced, that causes damage to the fetus. Therefore, try to avoid this indication when you become pregnant. When to avoid? A high dose of losartan should be avoided in people with volume depletion. So if you are using any diuretics, you should not use the losartan at higher doses initially, such as 100 milligrams. It may result in severe hypotension. Similarly, if you're under salt depletion, use losartan at lower doses. Losartan shouldn't be administered along with aliskiren in people with diabetes mellitus. Aliskiren is one of the medications that also acts on the renin-angiotensin system. This medication is a direct renin inhibitor. It is introduced to treat high blood pressure. Since aliskiren as well as losartan act on the same system, the renin-angiotensin system, they shouldn't be combined because this combination can produce significant hypotension and higher levels of potassium in the body. Particularly, this combination should not be used in people with diabetes. However, because of its high side effect profiles, this drug is nowadays little used. Similarly, ACE inhibitors should not be combined with angiotensin receptor blockers like losartan, because this may produce a dual blockade of renin in the angiotensin system that results in hypertension, syncope, hyperkalemia, and acute renal failure. Side effects. The common side effect of losartan is dizziness. You may have headaches and lightheadedness. Nausea and vomiting are also observed. Few people may observe diarrhea. It can also produce pain in the joints and muscles. Back pain can also be observed in people using losartan. Other side effects, like low levels of sodium, can be observed. Rarely, losartan may cause hypersensitive reactions that may result in the angioedema, leading to swelling of the face, tongue, and lips. Effect on alertness. Losartan can affect your alertness or coordination. Don't drive or do other activities that require alertness or coordination until your body adjusts to this medication. That's all, guys. These are the essential facts that you should know before taking losartan. That's all about this week's story. Share your experiences with this medication in the comment box below. Please do subscribe and hit the like button. Thanks for watching this video. Have a nice time, take care, and goodbye.